Mhm. Good evening. I am Dr. Shweta, Founder Medical Director, Samyak Drishti Eye Care Center, Bengaluru. March 6th to 12th, Glaucoma Awareness Week. Hence, a very short video about creating awareness about the glaucoma among general public. It's a leading cause of irreversible blindness. It is also called as sneak thief of eyesight or a silent killer of vision. Glaucoma is very dangerous condition because the patient is never aware that he or she is having glaucoma until the end stage. The condition never has any pain, redness or decreased vision to begin with. It will be very slowly and gradually progressing to give rise to loss of peripheral vision initially, and gradually the vision decreases to certain extent. The patient will have only a very narrow central tubular or a tunnel vision. So that is the stage when patient presents to you or an ophthalmologist about the decrease in the vision, by which time the most of the optic nerve is damaged and there will be a permanent blindness. Hence, it's very important to be aware of this condition, when to get evaluated and who are all at risk. So what exactly glaucoma, how it happens? It is a condition where there is a raise or increase in the ocular pressure or pressure inside the eye, which we call as intraocular pressure. Just like blood pressure, there is some pressure inside the eye because of the fluids inside the eye, which is important to maintain the shape of the eyeball. When there is a very high pressure inside the eye, the pressure is so much that the optic nerve cannot tolerate it, and there will be a permanent damage of the optic nerve, which leads to blindness. Glaucoma can be due to primary or any secondary causes, but definitely there is an optic nerve damage, whatever the cause of glaucoma is. Glaucoma never affects the sharpness of sight, but it always affects width or width of the peripheral vision. So the periphery or the visual field keeps on constricting to reach a central narrow tunnel vision. Let us know who are at risk factors. Anybody with a family history of glaucoma is always a risk factor for glaucoma. Any adult more than 40 years of age could be a risk factor. Diabetes and hypertension are definitely risk factors for glaucoma. And any eye injuries or multiple eye surgeries can also give rise to glaucoma. So anybody with family history definitely has to, whenever you go for an evaluation for your vision, do please mention to your ophthalmologist about your family history, and your ophthalmologist will perform necessary investigation to know whether you are having glaucoma or which stage of glaucoma you are in. Or anybody who are more than 40 years, is very important to have a routine eye checkup. Can glaucoma be treated? Though it cannot be treated completely, but it can be kept under best control when detected at early stage and good treatment is given. Like our BP and sugars, it's a lifelong disease but can be kept under control. It can be treated very simply or by eye drops if detected early, and maintained by regular evaluation. For some patients, if they do not respond to eye drops, there are laser procedures, and for advanced diseases there could be many surgeries to perform to keep the intraocular pressure or eye pressure under control. So the tip or what I would like to suggest is, everybody should have an annual eye checkup, whether he or she has any symptoms or signs. With so much of screen time, even pediatrics or adults should have a regular yearly eye checkup, and more so with the risk factors, it's very important to come for a regular evaluation. If there is glaucoma, frequent visits to be made to your ophthalmologist, and your ophthalmologist would suggest you what stage the disease is, what investigations to be done, and what is the modality of the treatment. So friends, let us not neglect our eyesight. This Glaucoma Awareness Week, let us take an initiative to have a regular eye checkup and spread to everybody about the importance of regular eye checkup and have a good eyesight. Thank you.